14 years ago, Margaret's father was diagnosed with shingles.
My dad's experience with shingles was an awful one. The pain was excruciating, and he really did suffer.
Shingles, also known as herpes zoster, is a painful blistering rash that can last for several weeks and may cause scarring. From what I've seen, the rash typically develops as a stripe on one side of the body, but may also affect the face. The nerve pain that comes from shingle usually goes away when the rash heals, but sometimes it can last for months or even years after the rash heals. It can be very painful. For some, the pain can be sharp or stabbing, and for others, it may burn or throb.
Initially, nothing showed up. He was just experiencing terrible pain. And then suddenly a rash appeared, and it was at that time that I had said to my mom, we really need to get him to see his doctor. And he was diagnosed with intercostal shingles, right pain right around the midsection.
The same virus that causes chickenpox causes shingles. Once you've recovered from chickenpox, the virus remains in the body's nerve cells. It may not cause any issues for years, and it can become active again without warning and can cause shingles. Anyone who's had chickenpox is at risk for developing shingles, so that's basically any adult. Your risk increases over time, and especially if you're over 50.
It's estimated that nearly 1 in 3 people will experience shingles in their lifetime. If you have had chickenpox and are 50 or over, you are at risk.
It's nerve pain, so the pain was awful. It really shut him down. It started to affect his sleep. He didn't want to socialize, which made him housebound, which not only impacted him, but also impacted my mom. And it even was affecting his personality. His mental clarity wasn't the same, and he was really quite agitated, which really isn't my dad.
Shingles can be a serious and debilitating disease and can cause long-lasting nerve pain and can interfere with day-to-day activities. There can be complications such as scarring, muscle paralysis, weakness, bacterial skin infections, or even loss of hearing or vision. Shingles can even result in hospitalization and in rare cases death.
There is a vaccine indicated for the prevention of shingles for people 50 years and older.
The vaccine boosts your immune system to help protect you from shingles. It is possible to get shingles even if you've been vaccinated. However, if you develop shingles despite being vaccinated, it can help reduce the intensity and duration of pain.
Well, the vaccine wasn't available prior to my dad getting shingles. But when the media started coming out and talking about the shingles vaccine, we all looked at one another and wished it had been an option for my dad.
If you're 50 or over, ask your doctor or pharmacist for the shingles vaccine.
My dad supports the vaccine, and he tells other people about his own experience and that they should consider the vaccine because it may help to prevent what he experienced.
Because everyone is different, the shingles vaccine does not protect all individuals from shingles. If you do get shingles, even though you have been vaccinated, it can reduce the intensity and duration of your shingles pain.
Both as a daughter and as a therapist, I certainly see shingles in my clinic on a regular basis, and people of all ages. And to have a vaccine and to be talking about this so people are informed is so important because it really does give an option to help people not have to experience what my dad did.
If you have any questions about shingles or Zostavax 2, speak to your doctor or pharmacist and visit theshinglesvaccine.ca.